Hi, I'm Alexander, and today we'll be discussing pharmacology. And pharmacology is the study of medication, how it reacts to the body, and the composition, and basically the side effects and the safe administration of medication. Right? Before administering any form of medication, you should contact medical director, right, to get the okay. Then you should do the vitals, right, because you want to know the patient's vital before you administer any form of medication. Also, it's very important to know the 6 rights. So, the right patient, ensure that it's the right patient to give the medication to. The right medication, ensure that this medication was indicated or prescribed to this patient. The right dosage, you don't want to overdose or underdose the patient. Ensure it's the right route, because you want to give it, for example, it's orally, you don't want to give it in another way. And the right time. Is it the right time of the day for the medication? So medication you administer 2 times per day or 3 times per day, so ensure it's the right time. You could also check if the medication is expired, and of course the right documentation, because if it wasn't written down, it wasn't done. Okay, so the 5 medication we'll be talking about today is aspirin, oral glucose, nitroglycerin, oxygen, and epinephrine. We'll be talking about their indications, reason to give it, contraindication, reason not to give it, the dosage, the amount to give, the route, how you give it, and the side effects. Okay, so my first will be aspirin. So aspirin is, it comes in a chewable form, right? And reason to give it is for like pain, fever, if persons are having chest pain, as it relates to acute coronary syndrome or myocardial infarction, right? Indication not to give aspirin if the person is allergic to aspirin, if they have recent GI bleeding, or if they have active bleeding, you should not give aspirin. The dosage is 160 to 325 milligram, and the route is orally. Side effects include GI upset, so as a result nausea and vomiting, and bleeding. Okay, so the next one we look at is epinephrine. Epinephrine, that's a bronchodilation and vasoconstriction type of medication, and they give it to persons who are suffering from severe allergic reaction, persons who have severe asthma, and even persons who are having a heart attack can get the epinephrine. Contraindication, well, there's not really contraindication as it commands to epinephrine, just not to give it to persons who don't have the emergency. The dose is 0.3 to 0.5 milligram, right? And the route is intramuscular. Side effects include tachycardia and hypertension, anxiety. You know, patient get restless. Next one is nitroglycerin, and you give this to patients who are having chest pain as it relates to angina or MI, right? And reasons not to give it: if the person is hypertension, right? Like if their systolic is lower than 100, you should not give them, right? Because the nitro will lower the blood pressure even more. So that's a contraindication. So that's why it's important to take the patient's vitals before you administer the medication. The dose is 0.3 to 0.4 mg, or it can be 1 spray. And of course, this medication you can take up to 3 times. So if you take it 1 time, you don't get the desired result, you can take up to 3 times. And the route is sublingual, that means under the tongue. Some side effects include hypertension and burning under the tongue, because that's where you put it. Alright, so my next one is oral glucose. Oral glucose now, this is like simple sugar used to increase the level of sugar, level of glucose in the blood. Alright, so you give it to patients who are suffering from hypoglycemia, that is low sugar level, right? And that's the indication. Contraindication is don't give it to patients who are unresponsive or unconscious, or basically patients who can't swallow. Don't give it to them. The dosage is 15 to 20 milligram, or half tube to 1 tube, right? And the route is orally, so ensure the person can swallow before you give them. Side effect, that's gastrointestinal upset, again, nausea and vomiting, and we move on to oxygen. Alright, so oxygen, basically, this is just gas, right? And we give it to patients who are suffering from respiratory distress, persons who are having like heart attack, or stroke, or basically the hypoxia, or you can see the cyanosis that their body lacks oxygen, you can give it. So that's the indication. Contraindication, you really not to withhold oxygen from patients, so there's not really any contraindications. However, patients with COPD, and they rely on their hypoxia drive, so you can't just give them like a 50 liter of oxygen. You have to start them slow, like 4 liters, because they rely on their hypoxic drive. The dosage is with the nasal cannula. The nasal cannula is 1 to 6 liter, right? And the non-rebreather mask is 7 to 15. So you can get up to 28 to 100% oxygen via the non-rebreather and the nasal cannula. The route is inhalation, my bad pronunciation, and side effects now, like if you are using oxygen, like the dry oxygen for prolonged time, that can dry out your mucous membrane, so ensure to use a humidifier to moisten the air, so to prevent the mucus from being dry. Alright, so these are my 5 medication: aspirin, epinephrine, nitro, oral glucose, and oxygen. Here ends my presentation on pharmacology and